Hello, good afternoon. I'm your host, Dr. Festus Asai. Welcome to the Medical Ultrasound Forum. Today, we want to look at insurance policy in ultrasound scan. When you say something, when you talk about insurance policy, what actually do you mean? We want to look at it right now. When you're scanning, there are a lot of factors or little principles that should guide you when you're scanning. And mind you, whenever you conduct a scan, the next thing you need to do is to append your signature on the scan you just conducted. Before you do that, you ask yourself, this result I am writing, I'm about to send out, do I have an insurance policy backing me up on this result I'm sending out? Well, I'm going to put you through some tips as we go along the line. You're welcome once again. I'm Dr. Festus Osai. Now, okay, good. Before I forget, we have an executive ultrasound training workshop in Lagos. We have different workshops we do. We have the individual workshop training exercise. We have the hospital-based training exercise where hospitals invite us to come and train their doctors and the paramedics in the basic skills in ultrasound scan. Then we have the group ultrasound training we do, either we do it alone or we do it in conjunction with different organizations like the AMPMP. Then also we have the executive ultrasound scan training workshop. This is based on popular demand. Some persons want few numbers to come and have a training exercise together. So this training exercise is going to involve the minimum of 5 doctors and maximum of 10. Of course, we'll have up to 7 when we are done. We'll come together in a nice environment, more relaxed, and we'll conduct the scan. Of course, we have some very wonderful topics that are going to be incorporated into this executive training exercise. We're going to talk about the thyroid gland, assessment of thyroid gland. We're going to look at the assessment of breast ultrasound. Then we're going to look at the scrotal ultrasound. Then another vital thing that we need to show you again about is talk about the umbilical artery and mid-cerebral artery Doppler in ultrasound scan for fetal well-being. These are the things you can do right at the confines of the office. And of course, you save life at the end of the day. Then we're going to look at transvaginal ultrasound, follicle tracking, and sex selection. For those of you into fertility, this will likely be of great interest to you. And some will want the sex selection. Yes, you can do sex selection in ultrasound scan. By virtue of my experience for the past over a decade plus, of course, the results have been quite fantastic. Then we're going to look at transrectal scan. This is not a very common ultrasound scan procedure. We're going to show you right now if you're part of the training program. Of course, we're going to look at solo HSG, ultrasound assessment of Asherman syndrome, endometrial polyp, tuberous patency, and the rest. This is another area that I think you should know and know very well. Then other things, early pregnancy abnormalities, fetal abnormality scan. Then other things that we need to add up to risk that we've been doing before. So this one is a peculiar training exercise, which I don't want you to miss out at that point in time. We have early beds, we have late beds, and of course, we have at the venue. Although this thing looks small, but we're going to send it across to different groups so you can get more details on how you can be part of the training exercise for medical directors, CMDs, and the rest. And of course, others that are in the business of ultrasound scan as well. Okay, that's the training workshop. Now, please just remember, the book is still available. That is my book. It's still available. Just try and get your copy. A lot of doctors have it across the country, but try and get your own copy. Because this is one of the ways you can also get an insurance policy. Okay, so we look at this. What is an insurance? Some people wonder, what am I trying to talk about? What's an insurance? Yes, we all know that, despite the detailed definition of insurance, we know that insurance is a thing providing protection against a possible eventuality. What are the possible eventualities in ultrasound scan? Wrong ultrasound reports, different misdiagnoses. So many things can happen when it comes to ultrasound scan. The insurance policy. So what is the thing that is backing you up for you to say you have an insurance policy as well? The insurance can also be seen as a way to manage risk. Ultrasound scan is a risk. As a scan is a risk. And mind you, there's this increased incidence of medical legal issues. As you are scanning the patient and writing the report and signing and penning your signature, you are actually taking a risk. So how can you be guided to prevent the risk? That will tell you well. And why do you say it's a risk? It's a risk because in ultrasound scan, you had, okay, let's see. Let me sign it. Okay, quickly. It's okay, for this patient. All right, thank you. So in ultrasound scan, you as an individual is the one that conducts the scan. You prepare the machine, arrange the patient, conducts the scan, and of course, you do all manner of things, just you alone, unlike in X-ray, CT scan, and the rest. Yes, the greatest side effect of ultrasound scan is not about exposure of the patient to the ultrasound wave itself, but rather wrong ultrasound reports. And how do you avoid wrong ultrasound reports? Of course, when you have what? An insurance policy. You're going to talk about insurance policy. So you can see this individual here. He does almost everything. He looks at the monitor, he manipulates the machine, He handles the patient, he handles the probe, and of course he's thinking. And there's a transmission of what he sees with the hand and what as he scans. And if this is not coordinated very well, of course, errors can come into play. Now, what is the insurance policy? Insurance policy is an acronym for INSURANCE. I stands for idea, N for what? Not manipulated, S, sensitive and straight to the point, U, understandable, R, reliable and of course reproducible, A, acceptable, N, not noteworthy, C, clinical correlation, and E, experience. Before you append your signature in any results, ask yourself, does it have an insurance policy? Number one, how do you back up this one with your insurance policy? Now, the scan you're going to conduct right now, you're conducting. Do you have an idea of the scan you're conducting? If you don't have an idea, that means you don't have an insurance policy on that very scan you're conducting. Then the results you are writing, are you trying to please the patient? The patient woman comes and say, I am pregnant. But you conduct the scan, you're not saying pregnancy. But you still in your report, you want to write pregnancy because you feel she's likely pregnant. So do not manipulate your report. Let it be exactly what you see than what you're trying to report. Then talk about sensible and straight to the point. Does your scan, does it make sense to you? Does it make any meaning to you as you are scanning? If it doesn't make a meaning to you, definitely it will not make to the next person they are writing the report to. Then understandable. Don't use some, the result you are presenting out, is it understandable? Can someone make an interpretation from what you have just written? And the report, if not, it doesn't make sense to you or to the next person. Then reliable and reproducible. Ultrasound reports, if they are not reproducible, they are not reliable. That's just the truth. And mind you, the scan that is conducted here in Nigeria should be the same scan that will be done elsewhere and abroad. If, for example, now, a multiple pregnancy, twin pregnancy in Nigeria, if it goes to America, UK, anywhere in the world, it should still be twin pregnancy. So the result must be what? Reproducible and, of course, reliable. Now, is it acceptable? Yes, if something is reliable and reproducible, then it is acceptable. Then is it noteworthy? Is there any clinical correlation? This is a very important factor in ultrasound scan. As you're scanning, a woman comes to you, say she's bleeding per vagina, she says, I am pregnant. She may likely be seeing her menses. So what you need to do, is your result, does it correlate with the clinical presentation or the history of the patient? A woman that has an LMP of just LMP of a month ago, you cannot be talking of retained product of conception. Are you getting it? Let's say 2 weeks ago. Let's say a month ago, so when she's supposed to see her menses, she's now bleeding, thinking she's pregnant, not knowing she's seen her menses. So the clinical correlation is important. You ask the patient, you ask some certain questions, you correlate with your answer, and check with your findings, and all this will now marry together. And that is why the biodata and the clinical information is important in your ultrasound report. Don't just write a report based on just the person just coming to you and want to do scan. There should be some certain level of correlation. Then you have an experience and expertise in the scan you're trying to conduct. If you don't have experience in that scan, that means you don't have an insurance policy in the scan you're conducting. Definitely you're going to make a series of mistakes, and of course, you know the right likely implication. So that's about the insurance policy. So as you're scanning, these questions, these things should go through your mind. And if all this one says yes, 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 and yes, then you know you have an insurance policy on that scan you are conducting right now. And let me tell you, nobody knows everything in ultrasound scan. And the knowledge of ultrasound scan is actually dynamic. So what you need to do, you learn the principles and follow it up. If you have a challenge, always have a course to call, to send message, and also to say, get for a second opinion. Thank God for the social media. Thank God for WhatsApp. Thank God for other video conference, video communication that can be made to make your life better. I'm here in Port Harcourt. I review cases across the country because of the simple device that we use, our phone, to do that. Of course, when I have a challenge, I have one to call that will give me a guide as well. Don't practice alone. If you want to avoid the problem, you want to avoid crisis or rather problem when you're scanning. Of course, for you to be backed by insurance policy, you must have room to belong to a group that discuss ultrasound, room to go through a training workshop, room to have the expertise, room to have second opinion, and be free to share the knowledge. Well, thanks for listening. I'm your host, once again, Dr. Festus Sai. Hope you enjoyed the little brief lecture. Try and have an insurance policy, and you'll be happy you did. Cheers, and God bless.